My name is Dr. Matthew Baker. I'm a board-certified plastic surgeon with Pittman Plastic Surgery, a world's leading clinic. What is nanofat grafting? Nanofat grafting is using a small amount of your own natural fat that's been processed into a fine liquid that is added to areas of your face that require rejuvenation. Nanofat grafting does not involve adding volume to your face or filling up your face. It's rather a treatment that promotes natural, self-derived regeneration of the skin quality. What can nanofat treat, and what are the common uses? Nanofat is specifically used for restoring and improving the skin quality, such as the skin tone, the removal of very, very fine wrinkles, crepiness, sometimes even sun damage, and skin color changes. The areas that we mainly use nanofat to treat are in the lower eyelids, sometimes in the perioral area around the lips and chin, as well as in the neck and even the upper chest. What is the difference between traditional fat grafting and nanofat grafting? Traditional fat grafting uses a harvesting and processing treatment of the fat that preserves most of the adipocytes or fat cells. It's used mainly for restoration of volume to the face or areas of the body that need additional volume. Nanofat grafting, on the other hand, processes the fat in a way that there's very few viable adipocytes in that tissue. Instead, it's enriched for the stromal vascular fraction, which really is full of important endothelial cells and stem cells and other cells, which help to restore and rejuvenate skin quality in different parts of the face. I would say the important part of the nanofat really, again, is the cellular components of it and the regenerative potential of that treatment. It really isn't a filler that would fill in or cause lumpiness in an area, or even add volume where you don't need it. Instead, the nanofat can come into the area, can elicit the cytokines and other signaling molecules that help to improve skin quality in those areas and make them really look natural in a slow and long-lasting way. Who is a good candidate for nanofat grafting? There are two main types of patient that present that would be good candidates for that treatment. There's the group that are looking for restorative or reversing the signs of aging that have already occurred. The other large group would be people that are looking at anti-aging or preventing the signs of aging from ever occurring. What does treatment look like from start to finish? The most important part is the initial consultation, in which I myself will evaluate the patient and determine if, in fact, they are a good candidate for that treatment. After that, we'll identify an area that we can harvest some fat from, a small amount. The tissue will then be processed and emulsified into a very thin fluid that can be injected carefully and meticulously in appropriate amounts to give the appropriate response from a biological standpoint. After the surgery, the patients will sometimes have a little bit of redness, swelling, and maybe even a little bit of bruising in both the donor site and the recipient site, but these are very temporary. With nanofat grafting, like other types of regenerative medicine, the effect actually doesn't occur immediately upon injection or treatment. It takes the body some time to respond biologically and to restore the skin quality, elasticity, and tone that we're looking for. In most cases, it takes between 4 and 12 months to see the final results of a treatment such as PRP or nanofat grafting. With regard to the duration of effect, that can actually go on for several months and sometimes even years. To learn more about nanofat grafting and restorative medicine, please visit worldsleadingclinics.com.